Welcome to NSG 313, Prenatal Midwifery. Study Section 1, Female Pelvics. Introduction. In this study section, we will be discussing the female pelvics. The woman's body is abducted by its shape and functions for unique feminine roles, for example, childbearing. It is important to be familiar with the anatomical features of the woman to understand the process of reproduction. Learning outcomes. At the end of this study section, you should be able to 1. Highlight the anatomy and various types of pelvics. 2. Explain the 4 types of pelvics and its features. 3. Differentiate the normal pelvics from abnormal. The anatomy of the pelvics. Below the anatomy of the pelvis and the various types will be explained. 1. Innominate bone. Innominate bones are also referred to as pelvic bones. There are 4 pelvic bones, 2 innominate, nameless or e-bones, 1 sacrum, 1 coccyx, 2 innominate bones. Each innominate bone is composed of 3 parts, namely the ilium, the ischium, the pubic bone. The ilium is a large flared out part. When the hand is placed on it, it rests on the iliac crest, which is the upper border. At the front of the iliac crest is the anterior superior iliac spine. Below it is the anterior inferior iliac spine. At the end of the iliac crest is the posterior superior and the posterior inferior iliac spines. The concave anterior surface of the ilium is the iliac fossa. The ischium is the thick lower part. It has a large prominence known as the ischial tuberosity, on which the body rests when sitting. Behind and a little above the tuberosity is an inward projection, the ischial spine. In labor, the station of the frontal head is estimated in relation to the ischial spines. The pubic bone forms the anterior part. It has a body and 2 projections, the superior ramus and the inferior ramus. The 2 pubic bones meet at the symphysis. Pubis and the 2 interior rami form the pubic arch. The space enclosed by the body of the pubic bone, the rami and the ischium, is called the obturator foramen. The innominate bone contains the acetabulum. One of the lower border of the innominate bone are 2 curves, the greater sciatic notch and the lesser sciatic notch. Image to show ilium, ischium and pubic bones. Iliac crest, ilium, acetabulum, ischium, pubis. Image of sacrum and coccyx. The pelvic joints. There are 4 pelvic joints, 1 symphysis pubis, 2 sacroiliac joints, 1 sacroiliac joint. The civic pubic is formed at the junction of the 2 pubic bones, which are united by a pad of cartilage, as shown by the image. The sacroiliac joints are the strongest joints in the body. They join the sacrum to the ilium and disconnect the spine to the pelvis. The sacrococcygeal joint is formed where the base of the coccyx articulates with the tip of the sacrum. During pregnancy, endocrine activities causes the ligament to soften, which allows the joint to give. This may provide more room for the frontal head as it passes through the pelvis. The symphysis pubis may separate slightly in later pregnancy. If it widens appreciably, the degree of movement permitted may give rise to pain on walking. The sacrococcygeal joint permits the coccyx to be deflected backwards during the birth of the head. Pelvic ligaments. Each of the pelvic joints is held together by ligaments. Interpubic ligaments as the symphysis pubis, sacroiliac ligaments, sacrococcygeal ligaments, sacrotuberous ligaments, sacrosupinous ligaments. The sacrococcygeal joint is formed where the base of the coccyx articulates with the tip of the sacrum. During pregnancy, endocrine activities causes the ligament to soften, which allows the joint to give. This may provide more room for the frontal head as it passes through the pelvic. The symphysis pubic may separate slightly in later pregnancy. If it widens appreciably, the degree of movement permitted may give rise to pain on walking. The sacrococcygeal joint permits the coccyx to be deflected backward during the birth of the head. The sacrotuberous ligament runs from the sacrum to the ischial tuberosity, and the sacropenius ligaments form the sacrum to the ischial spine. Diagram. These two ligaments across the sciatic notch and form the posterior wall of the pelvic outlet. The true pelvis is the bony canal through which the fetus must pass during birth. It has a brim, a cavity, and an outlet. The pelvic brim is round except where the sacral promontory projects into it. The promontory and wings of the sacrum forms its posterior border. The iliac bones, its lateral borders, and the pubic bones, its anterior border. The landmarks on the pelvic brim are 1. Sacral promontory, 2. Sacral ala or wing, 3. Sacroiliac joints, 4. Iliopectine line, which is the edge formed at the inward aspect of the ilium, 5. Iliopectineal eminence, which is a roughened area formed where the superior ramus of the pubic bones meets the ilium, 6. Superior ramus of the pubic bone, 7. Upper inner border of the body of the pubic bone, 8. Upper inner border of the symphysis pubic. Diameters of the brim. 3 diameters are measured. The anteposterior diameter is a line from the sacral promontory to the upper border of the symphysis pubic. At the uppermost point of the symphysis pubic, it is called the anatomical conjugate and measures 12 cm. When it is taken to the posterior border of the upper surface, which is about 1.25 cm lower, it is called the obstetrical conjugate and measures 11 cm. The term true conjugate may be used to refer to either of these measurements. The diagonal diameters is also measured anterior-posteriorly from the lower border of the symphysis to the sacral promontory. It measures 12 to 13 cm. The oblique diameter is a line from one sacroiliac joint to the iliopectineal eminence on the opposite side of the pelvis and measures 12 cm. The transverse diameter. It is a line between the points furthest apart on the iliopectineal lines and measures 30 cm. Another dimension, the sacrocotyloid, passes from the sacral promontory to the iliopectineal eminence on each side and measures 9 to 7.5 cm. Its importance is concerned with the posterior positions of the occiput when the parietal eminence of the frontal head may become cut. The false pelvis. This is the part of the pelvis situated above the pelvic brim. It is formed by the upper flared out portions of the iliac bones and protect the abdominal organs, but it's of no significance in obstetrics. The false pelvis is the part situated above the pelvic brim. It is of no significance in obstetrics. Types of pelvics and function of pelvics. 4 types of pelvics. 1. The gynecoid pelvis. This is the ideal pelvis for childbearing. Its main feature are the rounded brim, the generous forepelvis, straight side walls, a shallow cavity with broad, well-curved sacrum, blunt ischial spines, a wide sciatic notch, and a pubic arch of 90 degrees. It is found in women of average build and height. The juxtaminal pelvis, like a gynecoid pelvis in miniature. All diameters are reduced but are in proportion. It is normally found in women of small stature, less than 1.5 m in height, with small hands and feet, but is occasionally found in women of normal stature. The outcome of labor in this situation depends on the fetus. If the fetus size is consistent with the size of the maternal pelvis, normal labor and delivery will take place. Features of the 4 types of pelvics. Features: gynecoid, android, anthropoid, pletopoid, brim, rounded, arch-shaped, long oval, kidney-shaped. 4 pelvics: generous, narrow, narrowed, wide, side walls, straight, convergent, divergent, divergent, ischial spines, blunt, prominent, blunt, blunt, sciatic notch, rounded, narrow, wide, wide, subpubic angle, 90 degree, 90 degree, 90 degree, 90 degree. Incidence 50%, 20%, 25%, 5%. 2. The android pelvic. This is so called because it resembles the male pelvis. Its brim is arch-shaped with a narrow forepelvis and has a transverse diameter which is towards the back. The side walls converge, making it a funnel shape with a deep cavity and a straight sacrum. The ischial spines are prominent and the sciatic notch is narrow. The angle of the pubic arch is less than 90 degrees. It is found in short and heavily built women. Android pelvis predisposes to an occiposterior position of the fetal head. 3. The anthropoid pelvis. This has a long oval brim in which the anteposterior diameter is longer than the transverse. The side walls diverge and the sacrum is long and deeply concave. The ischial spines are not prominent and the sciatic notch is very wide. As is the women with this type of pelvis tend to be tall with narrow shoulders. Labor does not usually present any difficulties. 4. The platypelioid pelvis. This flat pelvis has a kidney-shaped brim in which the anteposterior diameter is reduced and the sacrum is flat and the cavity shallow. The ischial spines are blunt and the sciatic notch and the subpubic angle are both wide. High assimilation pelvis. This occurs when the fifth lumbar vertebra is fused to the sacrum and the angle of inclination of the pelvic brim is increased. Engagement of the head is difficult, but once achieved, labor progresses normally. Deformed pelvis. Deformation of the pelvis may result from a development anomaly, dietary deficiency, injury, or disease. Diagram. The female pelvis. The feature of the female pelvis enhances the process of a childbirth, provided the fetal size is normal. Functions of the female pelvis. Primary function is to allow the movement of the body, especially walking and running. It permits the individual to sit and kneel, transmits the weight of the trunk to the leg, acting as a bridge between the femurs, and also takes the weight of the sitting body onto the ischial tuberosities. Protects the pelvic organs and abnormal organs. The female pelvis is adapted for childbearing. Study section summary. In this study section, you have learned that the features of the female pelvis facilitate the process of childbirth if the fetal size is normal. The pelvic bones, joints, ligaments, and normal shape facilitate the labor process. End of study section 1. Thank you for listening.